Welcome to the deep dive. Today, we're jumping into something that sounds, well, pretty straightforward. Preparing for medical tests. You'd think it's simple, right? Just show up. But our sources show it's actually surprisingly fundamental for accurate healthcare. We've looked at insights from, some serious players focused on quality and safety. Think Joint Commission International, JCI, and India's NABH. Plus, some really practical guidance from healthcare experts like the folks behind the Supreme Medic Lifelines podcast. So our mission here really is to unpack the essential do's and don'ts from all this material. It's kind of a shortcut for you to understand how your prep directly impacts your results.
Exactly. And it's interesting how this small step you take at home, it really connects to the bigger picture, the goals of healthcare quality that groups like JCI and NEBH work on globally. Your role here isn't just, ticking boxes. It's actively helping to get diagnostic info that's actually meaningful.
Okay, so let's dig into why this preparation matters so much. The sources all seem to flag this core issue. People showing up unprepared. What's the big deal, really?
Well, it's a bigger deal than you might think. The main problem, and this comes up again and again in the standards and the guides, is accuracy. Everything from like what you ate or drank, even medications you took hours ago, can literally change what that test measures in your body.
Right. So if I sneak a coffee before a fasting blood sugar test, that number isn't really my true fasting level.
Precisely. It's reflecting the coffee, not your baseline state. And it's not just sugar, think cholesterol, liver function tests, hormone levels, all sorts of things. If the sample is skewed because you weren't properly prepared, the results don't show your actual health. And like the sources say, a test is only as good as the way it's done. Your preparation matters.
Yeah.
It's not just about the fancy lab equipment you see. It's the sample itself.
And I suppose inaccurate results just cascade into more problems.
Absolutely. You get an inaccurate result, maybe leads to a misdiagnosis, or best case, the doctor looks at it and says, this seems off. We need to do it again.
Which is a waste of time and
No.
money.
Exactly. Your time, possibly more cost, and it delays getting the right answers, starting the right treatment. Sometimes those delays really matter. And there's more. Some preparations are actually about keeping you safe during the test. Fasting isn't always just for accuracy. Sometimes it prevents nausea or other complications.
Huh. So preparation goes from feeling like, I don't know, a bureaucratic chore to being a really vital step you take. So the system can actually help you.
That's it, exactly. You're participating in the quality process actively.
Okay, let's get practical then. Based on what we've seen, what are the absolute must-dos, the key do's for common tests?
Well, the first one, probably the most common one people encounter, is fasting.
Right, the classic nothing by mouth. How long are we usually talking, and what does nothing really mean? Is water okay?
Yeah, good question. Typically for blood tests like cholesterol, glucose, lipid profiles, it's usually an 8 to 12-hour fast. And importantly, nothing almost always excludes plain water. Unless they explicitly tell you no water, water is generally fine, sometimes even encouraged. What you absolutely need to avoid, though, is coffee, tea, milk, juice, soda, and surprisingly, even chewing gum.
Chewing gum? Really? I wouldn't have thought of that. Why gum?
Well, it can actually stimulate your digestive system, potentially affecting insulin levels or other things they might be measuring. It's one of those small details that can matter.
Wow, okay. Note to self,
Yeah.
no gum before blood tests. What else is a major do?
Telling your doctor about all the medications you're taking, and I mean everything.
Not just prescription?
Nope. Prescriptions, over-the-counter drugs, vitamins, herbal supplements, the lot. Some of these could significantly interfere with results, things like thyroid tests, liver enzymes, even blood clotting tests.
And I should definitely not just decide to stop taking my regular meds for a test, right? That sounds risky.
Absolutely not. The sources are crystal clear on this. Do not stop or change any medication unless your prescribing doctor specifically tells you to. They know your situation, they know the test, they'll give you the right advice.
Crucial point. Okay, moving beyond blood tests, what about imaging? X-rays, CT scans, MRIs.
Prep varies a bit there. You might need to avoid food or drink for a few hours. Wearing loose, comfy clothes is usually a good idea. And for MRIs, this is non-negotiable. You must remove all metal, jewelry, piercings, watches, anything metal. That magnet is incredibly powerful. It's also really important to tell the technician if there's any chance you're pregnant, or if you're breastfeeding, or if you have certain conditions like diabetes. And if they mention using contrast dye, that stuff they sometimes inject to make things clearer, you need to speak up, especially if you have kidney problems, diabetes, or allergies. It's a safety thing.
You mentioned water earlier for fasting. Is drinking fluids part of the prep for other tests too?
Yes, sometimes hydration is key. For certain urine tests, for example, or for some imaging scans that use contrast dye, they might specifically ask you to drink plenty of water beforehand. It helps with collecting the sample, or can improve the quality of the images. So while fasting often restricts fluids, other times drinking more water is the do.
Okay, maybe we can touch on a couple of specific examples from the sources. What
Love it.
about ultrasound, say, for the abdomen or pelvis?
Ah, yes, the famous full bladder instruction. For a lot of those scans, you'll be asked to drink a certain amount of water before you come in, and importantly, not go to the toilet. A full bladder acts like a window, helping push other organs into view.
Right.
But, and this is important, some abdominal scans, maybe for the gallbladder, might need you to be fasting and have a full bladder.
Yeah.
So you always need to check the specific instructions for your test.
That seems almost contradictory. Fasting but drinking lots of water.
It can feel like it, which just highlights why you can't make assumptions. You need the exact instructions for that particular test.
Makes sense. And for samples you collect yourself, like urine or stool, any key do's?
Definitely use the sterile container the lab gives you. Don't just grab something from home. For urine, if they ask for a first morning sample, that means collect it right when you wake up. It's more concentrated. School samples should be, well, fresh. Ideally, get it to the lab within an hour and make sure you label the container properly and store it as they direct.
Got it. Sterile container, first morning urine if asked, fresh stool sample. What about tests that involve your heart or some activity? ECGs, echo, maybe a treadmill test?
Yeah, for those, comfort and clear access are key. Wear loose clothing. Avoid big meals, caffeine, or smoking for a few hours before those can mess with your heart rate. For ECGs or the treadmill test, don't put lotions or oils on your chest area beforehand. It makes it harder for the electrode pads to stick properly.
Ooh, good tip.
And yeah, for the treadmill test, don't forget comfy sports shoes and maybe a towel. You might actually work up a sweat.
Good practical advice. And what about those more involved procedures like colonoscopies or endoscopies? The prep sounds pretty intense.
It is rigorous, yes. You'll get very detailed instructions. Could be a special diet for days, taking strong laxatives, maybe a longer fasting period. The absolute crucial do here is follow those instructions exactly, to the letter. If you don't, the doctor simply won't be able to see properly because the area isn't clean, and the whole procedure might have to be canceled and rescheduled, which nobody wants.
I can definitely see how messing up that prep would be a major issue. Any other, maybe less common preparations mentioned in the sources?
Yeah, a few others pop up depending on the specific test. Things like avoiding certain foods, maybe red meat or specific herbal teas before some stool tests. Sometimes instructions involve avoiding strenuous exercise or even sexual activity before certain tests, or avoiding smoking. For some gynecological tests, there might be specific instructions about hygiene, like avoiding douching or certain creams. It really just reinforces that you need those specific detailed instructions every time.
Okay, that covers a lot of the do's. Let's flip it. What are the common mistakes, the don'ts that people fall into, according to our sources?
Right. These are the things that lead straight back to those inaccurate results or canceled appointments we talked about.
What's number one on the don't list?
Based on what we've seen, it often comes back to fasting incorrectly. People assume skipping breakfast is fine, or they have that quick sip of juice or coffee thinking it won't matter. Not completing the full 8 or 12 hours or having something other than water is super common and really messes up tests like blood sugar and cholesterol. Another big one is the medication issue again. Either stopping meds they shouldn't stop, or conversely not telling the doctor or lab about something they're taking that could interfere. You just can't guess with meds. Always check.
So trying to manage your own meds around tests is a definite don't. What about just being unsure about the instructions?
And that leads right to the third major, don't. Not asking questions. If anything is unclear how long to fast, is water really okay? Which meds to take not asking for clarification is a big mistake. People might rely on what they did last time or a quick Google search, but instructions can vary. Lab protocols change, or maybe this test is slightly different.
Don't guess, ask. Simple but effective. Any other common pitfalls?
Well, sometimes people go too far the other way with fluids. They avoid everything, even water, when water was actually allowed or even needed. That can make it hard to get a blood sample, for instance, or affect scan quality. And a really critical one, not sharing crucial information. Things like possibly being pregnant or breastfeeding or having certain allergies or conditions like diabetes. That information is vital for safety and for interpreting the results correctly. Don't hold back that info, even if it feels a bit personal or awkward.
Okay, so given all these details and potential mistakes, what are the absolutely essential questions you should always ask? when the test is ordered, or when you book it.
The sources actually boil it down to a really handy checklist. 5 key questions to ask your doctor or the lab every single time. Number 1, do I need to fast? And if yes, for exactly how long? Get that specific duration.
And clarify about water.
Exactly. Question 2, can I take my morning medicines before the test? Nail that one down for sure. 3, do I need to bring anything with me? ID, insurance card, maybe old reports, those sports shoes we mentioned. 4, will I need someone to come with me? Important if you might be drowsy after or just for support during a long test. And number 5, how and when will I get the results? Just helps manage expectations. And a great bonus tip from the sources. If you get home and realize you're still unsure about anything, just call the lab or the doctor's office the day before. Don't wait until the morning of the test.
That 5-question list is brilliant. Really practical. Now, does the prep change much depending on who is getting the test? Like kids or older people?
Yes, these sources touch on that. There can be special considerations. For children, you might need to ask about child-friendly ways to collect samples or tips for managing fasting if needed. For elderly patients, they might need a bit more help remembering the instructions or support during long fasts, making sure they stay hydrated if water is allowed. Diabetics need to be particularly careful. They must ask their doctor about adjusting insulin or medication doses for fasting tests. That's critical to avoid dangerously low blood sugar.
That's a really important safety point for diabetics.
Definitely. And for women, if you happen to be on your period when a test is scheduled, especially a urine test, you should let the lab know. Sometimes blood contamination can affect results, and they might suggest rescheduling.
Good to know. Okay, so you've done the prep, asked the questions, survived the test. What happens next? The final stage.
Right after the test. First, make sure you know when and how you'll get the report. Will they mail it? Email? Is there an online portal? And then, crucially, the sources really emphasize this. Don't try to interpret the results yourself. Dr. Google is not your friend here. Test results need context, your history, your symptoms. Wait for your actual doctor to review them with you and explain what they mean. And finally, keep your reports organized. Maybe a file, maybe digitally. Note the date, the test name. Things like the ABDM Health ID mentioned in India can be useful for storing and sharing these records easily and securely.
This has been incredibly enlightening. It really takes something that seems simple and shows you the layers underneath. So bring it back to you, our listener. What's the big takeaway here? I think it's that these small steps, following instructions carefully, asking those 5 questions, being open about your health status and meds, they aren't just bureaucratic hoops. They directly impact the accuracy of your tests. And accurate tests. That's the bedrock for getting the right diagnosis faster, the right treatment sooner, and just having a smoother, safer journey through the healthcare system, whether it's a JCI or NABH credited place or anywhere else.
Absolutely. It changes your role. You're not just passively having a test done to you. You're actively participating in ensuring the quality and safety of your own care. Your informed preparation is genuinely a powerful tool. It aligns what you do personally with those big picture goals of quality that these organizations champion.
Well, that wraps up our deep dive into the surprisingly crucial world of medical test preparation. Hopefully you feel a bit more empowered for your next appointment.
And maybe just keep that final thought from the sources in mind. Ask twice, prepare once. Your health depends on it. Something to really chew on before you head out for that next test.